John Hook's Newsmaker Saturday starts now.
Thanks for joining us for Newsmaker Saturday. Hope you're enjoying your Thanksgiving break, and probably this program is coming on a little late considering you've already had the family gatherings, but we've got to tackle COVID again because in the last few weeks we've seen a pretty sharp increase in cases in most states and in Arizona. And to talk to us about it, a guy who's on the road right now from Brooklyn, New York, the former state health director, Will Humble, who's the executive director of Arizona Public Health. First of all, thanks for taking time out from family to do this, Will.
Yeah, thanks. My pleasure, John.
Okay, so Will, what's the bottom line? What's happening out there? What are we seeing?
Yeah, this is a double dip Delta surge is what we're really looking at. We saw that run up in cases a few weeks ago. It started to moderate a little bit, even plateaued a bit. And now we've got almost an exponential run up in cases. But more troubling to me is the hospitalization part of this, because we just simply don't have the existing hospital capacity to deal with what is here now and what's to come in the next month. And it's going to impact not just unvaccinated persons that get COVID that need hospitalization, but people who just need normal hospital care because it's just that tight within the hospital system, and especially with the staffing levels that we have. Let's
take a look. I'm on the board now, and we'll take this full. But these are the number of cases, and you could see as we've gotten into this November period, and again people start getting inside. We'll take this full, and you'll see. November, and as we head into early December, we're getting a spike, a pretty good spike in cases, even one day where we hit 5,000. Now, I guess that may have been some kind of compiling situation as well after a weekend or whatever it may be, but those numbers you can see are clearly going up.
Oh, absolutely. They definitely are. And again, some of those are breakthrough cases. About 20% of those are breakthrough cases. People have been previously vaccinated, but the troubling thing is that there are still about 2 million people in Arizona that haven't been vaccinated, and they're the ones that are so vulnerable. And and the big wild card here is, of course, the Delta variant. I mean, without Delta, we would not be in the same situation that we're at. It's just so much more transmissible than that previous version, Alpha, and before what we had last summer, which was the regular California strain.
Okay, you mentioned it. We're right now in a situation in the country and here in Arizona where about 1 of every 5 cases is a so-called breakthrough case. This means somebody who has previously been vaccinated and they're developing COVID again. I thought the vaccine was supposed to stop this stuff.
Well, here's what the vaccine does. It helps your body generate antibodies and T cells that protect you from severe infection. And when you're exposed to the virus again, especially after a few months, whether it was a previous infection or whether it's a vaccination, your antibody titer drops off a little bit. But your body you've got some they're called bursa cells, B cells, that are at the ready to make antibodies really quickly. And so that breakthrough infection is a lot less severe, usually pretty mild. Because your body's able to ramp up the antibodies really fast. Those B cells don't have the learning curve that they did when you were just first vaccinated. So that's what we're dealing with, is breakthrough cases that are generally mild, not exclusively, but for the most part, pretty mild. And so over time, I expect to see the percentage of the cases that are breakthrough go up and up and up, but they will also get milder and milder and milder in terms of the level of infection, and eventually won't really pose a threat to our hospital system.
Okay, so is that to say that when I'm back at the wall here, is that to say then that we shouldn't overstate case numbers? That case numbers in this stretch of the pandemic may not be as meaningful as they once were?
I totally agree with that. It's not the case numbers that you should be looking at. If you're looking at the newspaper, if you're watching, if you go into the website, look at the hospitalizations. Look at the percent capacity that's in our ICU and general ward floors. Look at the emergency department visits. So it's the more severe infections that are putting a strain on the hospital system and affecting both COVID people and people without COVID at all, who have a stroke or something like that. That's where we are now, is not so much. I don't focus that much on the pure numbers. What I look at is what's the situation in the hospitals, and it's not good now, and it's getting worse.
Okay, and the other place where the rubber meets the road, clearly, are deaths, and we'll get to that in a minute. But this is a look at COVID-like illness, and you can see it. You know, these are the graphs where we've seen where the spikes have been in the past. That 2020 spike where we got that in December, then the initial spike that we got basically in May and June in 2020, and now we're kind of embarking on a bit of another spike here, even though it starts to decline, it looks like slightly. What do you make of these kinds of waves that we're getting in this illness?
Yeah, this one, we're really in so this latest one, I just call the Delta wave, and it's a double spike wave. You can see that there. And it's, we do have a fair amount of, especially the seniors. We have good vaccination rates among seniors, but our vaccination rates among adults in their 30s and 40s isn't that great. And as I said, there's almost 2 million people that haven't been vaccinated yet. That's a big pool of susceptible folks. And I think we're going to continue to see that Delta wave look up and down throughout the rest of the winter the way it is. And I'm a broken record here, I think, but my biggest concern is people being able to get treatment in the hospitals. And, the solutions are getting more people vaccinated, implement policies that incentivize people to get vaccinated, and then that simple thing, which is universal mask wearing in crowded environments.
Okay, Will, let's take a look at deaths. The deaths here, and again, there's a lag in reporting. So as we take this full, you can't really look at these last few days, right? Because you haven't gotten the full picture. The deaths lag several days. But it doesn't look like, in terms of deaths, we're kind of back to where we were maybe in, May, June of 2021. So, this doesn't look dire, but
right.
How do you read it?
No, I agree with you. And it's because the vaccination rates among seniors are so good. And also a lot of seniors are enthusiastic and are going out and getting their booster vaccine, which is a good thing. So, I don't expect us to see anywhere near the lethal situation we saw in January of 2021 because, it's the vaccine. I mean, that is protecting people. And as you said, as we talked about, there will be the breakthrough infections, but they're not going to be as severe, and they certainly don't put somebody with threat of their life.
Do we know, Will, what the vaccination hesitancy rate is for the COVID vaccine versus flu? Because I think, we're still kind of at that 60% are willing to get it. And then you've got another group that, for whatever reason, and I wouldn't doubt their reasons. I think people, have looked it over. They've had plenty of time to look at the data and figure out what they want to do. Are we ever going to get beyond that number? I mean, it seems like there is just a certain threshold that you may not be able to bust through.
No, I agree with that. There's no amount of public service announcements that are going to move this needle. The only thing that's going to do it are the OSHA rule, the new federal rule for the Labor Department that's going to require employers of more than 100 people to get their staff vaccinated. That will compel more people to get vaccinated.
But that's stuck in the courts right now. I mean, we've got a whole court battle going over that, and there are a lot of people who don't like that idea. That's correct.
But if it goes through, that will improve the vaccination rates through policy. And the Center for Medicare and Medicaid Services has their same requirement, also a January 4th requirement. That is in a lot less jeopardy in the court system. I expect that one to go through. That will have an impact. But public service announcements aren't going to do it. It's going to have to be something that a person is compelled to do because of their job. Okay. That's the only thing that's going to raise the vaccination rates, I think.
Let me give you the public health podium here for a minute. If I'm a person who says to you, I run into you in a restaurant and I say, well, all these people getting COVID now have had the vaccine. Why should I get it? What would you tell me?
Well, number one, if you haven't been vaccinated, well, first of all, I'd ask them if they had the previous infection, because that's part of the equation. Because if they have a previous infection and they're deciding not to get vaccinated, I'm going to have a different conversation with them than I would have with someone who has not been infected with the virus and has decided not to get vaccinated, because that person, the unvaccinated, uninfected person, is the person that is putting their life at risk. And that's really, they're rolling the dice. And I would say to them, look, would you go skydiving if somebody told you that there's a 2% chance the chute's not going to open? See what they say.
That's really interesting. Okay, so when we talk about the number that have not been vaccinated in Arizona, that's about 2 million?
Close to a little under that, yeah.
Will, isn't it possible that there's a big percentage of that 2 million who have had COVID already?
Oh, absolutely. I don't know what that percentage is, but it's a sizable percentage of that 2 million has been infected. Some of them know it because they had a PCR test. Some of them may have had a touch of something and didn't go get tested and think they've been infected, but aren't sure. Some have done the antibody tests, but that's not a reportable result. So yeah, some of that 2 million for sure have been infected and recovered, and they do have some antibody protection, and they are at a lot less risk of having a hospitalization or dying and that's really still a breakthrough, even though it's a previous infection, not a vaccine.
Okay, so what do we glean from that as to where we might be on herd immunity if you start factoring in how many people have actually contracted COVID but never got the vaccine?
Yeah, so I'll put in by sort of looking into the future machine and say, if you tell me it's 2024 or 2023, what's this going to look like? And this disease, this virus will become less and less lethal over time. And the reason that's going to happen is because a bigger and bigger percentage of the population will have some immunity, whether through natural infection or whether through vaccines. And so the cases that do happen, and there will always be breakthroughs, will be less and less severe. And we will still have COVID-19 on the scene in 2023 and 4, that's for sure. But it won't be as lethal, and we can stop calling this a public health emergency because the level of immunity will be sufficient to get to make this less severe. But we're never going to get to where we are with like measles, that kind of herd immunity. We're going to get to a more what we call endemic, a kind of enough immunity in the community so that the virus becomes less lethal and therefore not a threat to the hospital system and therefore not a public health emergency.
So will it be analogous to a flu season? You'll have a COVID season too? Will it be like that?
Yes, but I expect the COVID season to last all the time. As we've seen, this virus loves the summertime, which is different from influenza. So it'll be like influenza, sort of. But it's not going to be as seasonal.
Okay,
that's what I think.
Let me run one more thing by you. I was looking at the numbers today of the states and their deaths per 100,000 population. Here are the top ones. These are deaths from COVID per 100,000 people. Top of the heap, I think, is Alabama right now. Louisiana, Arizona, New Jersey, New York. Okay, so we've got a whole array of states that have looked at this and handled it differently. New York, New Jersey, very restrictive on COVID rules. Arizona, a little more laissez-faire. Alabama, much more open. Louisiana, more open. So it strikes me, Will, that this virus is doing its thing, and it maybe didn't matter much what states did in their policies. Everybody's kind of going to have to live through this thing.
Oh, policies mattered a lot. The big difference between Mississippi, Alabama, Louisiana, Arizona, and New York and New Jersey is the timing. If you look at the deaths per capita throughout the length of the pandemic, you'll see that the New Jersey and New York deaths were skewed into the early part of 2020, whereas these states like Alabama, Mississippi, Louisiana are states where it was lethal throughout the entire period. And we've caught up to those New Jersey, New York states. So if you look at policies, it makes a huge difference. Just take what I like to do is to compare us to Colorado and the state of Washington. We all have about 7.2 million people. We had very different policies in place throughout this pandemic. And Washington and Colorado had about a third of the deaths that we had per capita in Arizona. And it is attributable, in my opinion, to the far more evidence-based policies that those states put forward when compared to ours. So policies do make a huge difference.
You're saying then lockdowns and really strict vaccination requirements and mask mandates, that made a difference?
Yes, and not so much the lockdowns, but the universal masking requirement. The airborne part of this has been so significant. Lockdowns in the sense that those two states were far more stringent around capacity limits in bars, restaurants, and nightclubs, and actually did enforcement of those provisions in our states. Whereas in Arizona, we didn't do that. So that's the big difference. It's not so much the lockdowns, but those interim measures like universal masking.
Are we far enough downstream now to look back on this 2 years? I mean, we've got a 2-year sample. What have we learned, public health-wise, about this and how we handled it?
I think the biggest thing we learned early on is how incredibly airborne this virus really was. Remember at the beginning, we talked about hand washing and all that kind of stuff. Now we know that is not really a big deal. People were washing down packages. That turned out not to be useful. We learned about how airborne this is, how effective universal masking is. And we've talked about this on the show, that the regular cloth masks that you see around town and that I wear are not great filters this direction, but they're very good at stopping particles from leaving somebody's mouth. And so when you have an entire classroom or an entire workspace where everyone's wearing masks, it keeps the particles out of the air. And that's why the masking is so effective when it's universal. When you're the only one wearing a mask in a crowded room and it's just a cloth mask, it's not doing hardly anything. You have to have it be universal. So we've learned that. Another thing we've learned is how incredibly impressive the vaccine manufacturers can be when you take the financial risk out of the system and get rid of the red tape in terms of administrative development of vaccines. To develop these 3 safe and effective vaccines in less than a year was incredible. And my hat's off to the previous administration. The Trump administration did a great job at developing these vaccines. That's nice to hear.
The former administration takes a lot of heat, but they did get this thing out there.
They aced it. They got an A+ on the vaccine, in my opinion.
Will Humble, thank you, and we give thanks to you for all of your good information during all this, and we'll have you back, unfortunately, because there'll be another twist and turn in the road. But thanks, Will.
All right, my pleasure.
Good to see you. We're back in a minute, and joining us is Maricopa County Sheriff Paul Penzone on the state of policing right now in this country, and particularly in Arizona and Maricopa County. We're going to talk to Paul Penzone about that in a moment. Back on Newsmaker Saturday, and we're pleased to be joined by Maricopa County Sheriff Paul Penzone. Of course, Paul Penzone was first elected in 2016 and then re-elected in 2020 by a 16-point margin. It was a pretty sizable victory. Sheriff, good to see you.
Thanks for having me, John.
Paul, I've first got to ask you, you've had a tough, very tough month. We'll show the video of Lieutenant Chad Brackman. He was a 22-year veteran with MCSO, struck and killed while working traffic while off duty, married, 2 children, long-time employee. Can you just give me a sense of how you manage these kinds of things? Because this comes with the job, unfortunately.
It does. And I remember a mentor of mine when I was elected told me one of the most important responsibilities that we have is to make sure that we care for our employees, and that if we have a devastating loss of life in the line of duty, that we make sure we show them and their families all the respect possible. And I think the toughest part from a position, when you're the head of an office, is ensuring that you show the men and women that even though we are grieving, even though it's difficult, and you care for them, that leadership has to have that strength, that they know we will get through this, and that even though our job is very dangerous and we lose those that we love occasionally, that we have a greater calling. So they have to see that strength, that stability, and know that they have, an organization that cares for them first.
Earlier in the month, you had Juan Ruiz. He was 3 years with the department. He was brutally attacked by a 30-year-old suspect, Clinton Robert Hurley, at the sheriff's substation near Van Buren and Dysart. He was booking Ruiz into jail. He was booking Hurley into jail. And he was trying to place him in a holding cell, and Hurley turned on the deputy and a fight ensued. This was horrific, the attack. Hurley escaped for a time, but the thing that also caught my attention in this was Ruiz's family deciding to donate his organs?
Yeah, it's a powerful statement. A selfless family that even in this time of considerable loss, they wanted to do more for the community, knowing that they lost someone they loved, but they could help others who were loved by saving their lives. So it is just an extension of this sacrifice, and it shows just who they were as God-fearing people who believe that first and foremost you do for others, even when you yourself are adversely impacted. So I think both those examples are men within our organization. We have men and women who really are caring, good people that do a difficult job. And you hate for these moments to be so defining in contrast with a lot of the criticism that we face in law enforcement. But it is a reminder. Stop criticizing those who carry a heavy burden. If individually or in unique circumstances we fail, then yes, hold us accountable. But these men and women are exceptional, and it's time for us to celebrate them every day, not just when we see them die in the line of duty.
This is a great segue into what I wanted to talk to you about most of all today. The state of policing right now in the country. Are you having trouble filling your positions? A. B, are you worried that communities are no longer supporting you to the level they used to in the past? That there have just been too many movements, too many questions, too much, whatever it is, media coverage of events that are really a small slice of the law enforcement world that have kind of defined, to some degree, the role of law enforcement and maybe defined it wrongly?
Yeah, no, I think you're selecting the correct word there when you say define. You know, I believe that, and I've been in this business for 30 years, and I don't think it's ever been tougher for those coming into this profession than it is right now. And it has to do with the level of oversight, which is understandable and acceptable. It makes us better. But the level of scrutiny and demonization has escalated. And I would tell you that it is a small percentage of the population who is acting on a small percentage of incidents within law enforcement that do not truly reflect the greater good, but have to be addressed. And what has happened is this, as I use the word demonization, has grown to a bigger capacity. Men and women who maybe considered this profession in the past suddenly ask, why would I? Why should I? And that's detrimental. Now, are we having problems recruiting? We are, but there's a lot of factors, John. As an example, we have about 2,400 spots for detention officers in this organization. And prior to COVID, I believe we had 40 vacancies. Now, since COVID, I think we're approaching 400. And for the men and women still doing the job, it's dramatic.
Why is that, Sheriff? Why has that number grown so much?
Well, part of it was the fact that we couldn't recruit and run academies to the same capacity that we had before because of COVID rules and guidelines to try to keep people safe. The other part of it is it's difficult to work in a closed environment when you have a transient population, meaning inmates that come and go every day to the tune of 200 to 300 new inmates who are bringing potential infection into the jail. These men and women that are detention officers have families. They have young ones, and they have those that are their elders that they care about, and they potentially could be taking that infection home. So I think a part of it is that, and I think a big part of it is, yes, this job faces a lot of scrutiny. And when you weigh that against maybe the compensation or the benefits, maybe historically it sounds like, oh, it's a stable job. Now suddenly you question, do I really want to be in that space for that type of compensation, facing that scrutiny and potentially putting my family in a position of liability and detrimentally in a pandemic?
Let me ask you quickly, we've got 40 seconds left. This is a tough one, but oversight, you mentioned it. How should police shootings and questions about policing be handled? Do you believe that community groups with literally no law enforcement background should be deciding the fate of your officers?
No, I think they can play a part in the process and be in a space where transparency and input is accepted. But I've been working with my colleagues, a lot of the police chiefs from around the valley, to the tune of about 15 or 20 of us for the past 4 months, to develop a couple potential solutions. And we're hopeful that in the near future, meaning maybe in the next month or two, we'll present what we believe are the two best options. Every chief that I've spoken to and myself, we all believe that accountability and transparency is the number one priority. And by utilizing an outside qualified team of law enforcement professionals to conduct the investigations is the best pathway, as opposed to us investigating ourselves. But those without experience can be a part of the transparency process. They cannot be a part of the investigative process.
That's interesting. Sheriff Paul Penzone, appreciate your time, and thanks on this Thanksgiving weekend. Appreciate it.
Thank you, John. I appreciate the time, and many thanks to the men and women of the Maricopa County Sheriff's Office who, when everybody else is home eating or home sleeping, they're out there doing the job, as well as the other officers around the valley. So thank you so much. God bless them.
Thank you, Sheriff. We're back in a minute.